CHI Health cardiologists perform thousands of life-saving heart procedures a year. They are at the forefront of care.
As we imagine better health, we're looking at some big changes, improvements which mean you are 30% less likely to die from a heart attack today than 20 years ago.
Here this morning, CHI Health cardiologist Dr. Joe Thibodeau. Doctor, thanks for stopping by this morning.
It's nice to meet
You're
you.
welcome.
Nice to meet you.
Nice to meet
So
you
you're a
guys.
cardiologist, but what does it mean to be a cardiologist? It deals with the heart. We understand that,
Absolutely.
but specifically, can you break that down for us?
So, well, we take care of basically prevention and treatment of problems with the heart and cardiovascular system. Yeah.
Anything that ties back, right? Vessels, all of
Absolutely.
it.
Yeah.
To me, this is one of those worlds, and only because I've seen it within my own family, where it's amazing some of what's happening now compared to when my grandmother, for example, when I was a little girl, was dealing with some of this stuff. And a handful of cardiology categories. So when we talk about like non-invasive, invasive, what are you specializing in?
So, well, my own personal specialty is invasive cardiology. But as cardiologists, you're right, we split it into multiple different sort of groups. So there's non-invasive cardiology. This is the kind of thing that typically occurs in an office setting. Echocardiograms, EKGs, counseling, maybe some medications are prescribed. We do invasive cardiology, which is mostly going to happen in a hospital setting, where we do things like heart catheterizations, stents, and then some more advanced care that's just really exploding. And we do a lot of things with electrophysiology. So this is the kind of the electrical system of the heart. If you think of pacemakers and defibrillators, and then some other specialized things like ablations. But a lot of those can also be handled with just medications and counseling as well.
You throw a lot of terms out there, and it can be complicated. But how far has your field come in the last 20 years when it comes to dealing with the heart?
Well, like you guys said earlier, so in the past 20 years, we've gotten so much better at taking care of things that, well, for me are everyday occurrences like heart attacks. So they happen every day. When you come to the hospital with a heart attack, you're 30% more likely to survive now than you were just 20 years ago.
So, and you're able to sort of get them into the cath lab faster. What kind of difference is that making in preserving the heart and making sure that patients not only survive, but they're in better shape, and they're sort of like the quality of life is impacted when you're getting to them quickly?
Absolutely. So you're right about getting them in faster. So it's not just us, it's a whole chain of people that get them into the cath lab faster. So it starts with our EMS in the field. So a lot of the ambulances now will have an EKG machine on the ambulance, and they'll check the EKG. If they recognize a significant problem, they transmit to the ER before the patient even gets there. If the ER doctor agrees, they call the cardiology team in before the patient shows up. Sometimes we're ready to go.
So you're ready for that patient before you ever see them?
Some of the time, we absolutely can be. Yeah.
And taking that quick action has a dramatic impact on the outcome. How dramatic is that, taking quick action?
You bet. I think that that 30% less likelihood to die is basically based upon people getting in more rapidly. So if you think of it like in trauma, they talk about the golden hour. If you can get somebody to a trauma center in the first hour, we think of it pretty similar. If patients can recognize that their chest pain might be a heart attack and they can come into the hospital within the first hour, we're really good at helping those patients survive and thrive, and we save a lot of heart muscle, avoid downstream problems.
And I'm thinking about even in the last few years, this awareness about women understanding the symptoms and how a heart attack looks in us compared to men. And it's like we're starting to get it. Light bulbs are going off. But then as we talk about these other big changes, and Mike mentioned some of these words that have multiple syllables. So pardon us if we don't get all of this, but I want to show our viewers a list of some of these other big changes that have come about in heart care. What stands out to you on this list, and make it simple for us to understand, if you could, in terms of impact?
Oh, I think the thing that stands out is the top on the list. There, transcatheter aortic valve replacement. So traditionally, if you needed an aortic valve replacement, the only way to do it was open heart surgery. You would have to crack your chest, have a surgeon replace your valve. But now, for some of the patients, they can have the valve put in through a puncture in the artery in their leg. Saves them a long recovery.
Well, how does that work? And then the valve goes in. It goes in through the side, and then it gets up to the heart somehow.
We put it over a wire. We use the wire as sort of like a railroad, and so we We put it over a wire, and the valve is loaded onto a balloon. We position it right in the proper place, expand the balloon, and the system is designed to hang onto the walls, basically.
That's amazing.
And I'm looking at that left ventricular assist device.
Right.
LVADs. My father-in-law had one. We had 5 years with him that we wouldn't have had without that technology.
Absolutely.
It was unbelievable the way that works.
Absolutely, yeah. People that need an LVAD, they're at the end of the line. Their
That's
heart
their last
no longer
option.
works as a pump.
Yep.
You know, some of the people are getting them so that they can, you know, hopefully survive a transplant. Other people are getting what we call a destination LVAD. They're going to get this LVAD, and they're going to have it the rest of their life, but it will buy them maybe a year, 2 years, 5 years.
Seeing grandkids graduate, it was birthday parties. That's the way as a family we measured that, and it was everything.
And
Right.
those LVADs are getting better themselves, aren't they?
They are. So what's interesting now is they're what we call pulseless. So they are continuous flow. So they have, when you have an LVAD patient in the office, they have no pulse. Their blood just can.
It's a whoosh.
Yeah,
It's a whoosh, and
it works great.
It is wild. I
Yeah.
want to show our viewers where to find you, but give us one word about managing lifestyle factors and
Heart
then
health in general. Yeah.
yes, and activity. What can our viewers take away and do differently today because of your visit?
Right. I think the most important thing is that people need to take control of their risk factors. We know that heart disease is preventable. We know that over 90% of heart attacks are attributed to modifiable risk factors. So, you know, a lot of people think that we have the hard job as cardiologists, but I think the hard job is living a healthy lifestyle. That's 99% of the work. So exercise, diet, don't smoke, watch your blood pressure, watch your cholesterol. If you're diabetic, take control.
Yeah, genetics, family history, another big one too.
Absolutely.
Yeah.
Dr. Thibodeau, I'm so glad to meet you. Thank you for being here today.
Thanks
Thanks,
for having me,
appreciate it.
guys.
Time. So the newest exhibit at the